Hi, my name is Takamaru. I've been a community health worker for UMS for since 2014 until now. I started out as a contractor in 2014, became a full staff in 2017. A community health worker is a member of the community that is there to help bridge the gap between the health providers and their patients with medical terminology and anything that is needed regarding their health. Interpreting is part of the services that a community health worker provided. It is one of the many services that they provided, but they provided more than that. They help with navigate the health system for the patients, also help them with local resources, as well as helping the health providers um, understand their patients. The reason why it is very important to have a community health worker in your team member is because they're there to help you with any barriers you have regarding to your patients. For instance, uh, you might get mad at a patient that they're not complying with their medications, but there are most of the time there's a lot of roles that play into that they're not able to be complying with their medications. One of them maybe because they have no control over it. They live with family members who might have had a car or vehicle that is broken down, or they're at work and they have to weigh in, do they have to miss a day of work or go pick up the medication. So there's a lot of factors that play into that. And so that is the reason why you have to have a community health worker to help you and get that information. So that way you understand that it is not the patient is not trying to comply, but there's a lot of barriers they're facing themselves. And also, sometimes I notice that a doctor will come with their medical terminology or their medical mindset. And for me to interpret that to a patient that has a fifth grade education, I have to take that from that mindset to this mindset. And that is, and there's a lot of things that plays into that. You have to think about the culture, you have to think about their level, education level. And so that is the reason why it is very important to have a community health worker. It's because to bridge that gap, whatever barriers there is, they're there to bridge that gap for you. I really wish all the clinics, um, hospitals, healthcare facilities hire their own community health worker, because that is the key to provide the appropriate and the proper care you need for your patients. So yesterday there was a really good example of a story of being a community health worker. Um, we had the doctor was asking the patient, "Can you tell me the name of the medication?" And the patient is like, "Okay, hold on, because I have to look through my purse to get it." And the thing is that the she doesn't know the name, and most of the patients they don't know the name. They just know that it is for blood pressure or it is for diabetes, but they don't know how to, and because they don't know how to pronounce the name, and but they know what is it for. And sometimes they don't know what's the medication for. They just know that they're supposed to take it this way. Anyway, going back to the story. So the story is this, that she was looking for the medication and to get name of it. And the doctor's like, okay, go ahead and just spell it out. And she's like looking for somebody because this was over the phone because we're having appointments on the phone. She's looking for somebody to get the name to us because I guess she could not read the. I kind of like felt that she didn't know which is the name of the pill on the label, and she was just looking for somebody in her house because she's asking, and I from that I kind of get the feeling that that was happening, and so I was telling the doctor, I'm like, I think she doesn't know this. Can we ask her to take a picture of it and text it to my working cell phone? And that's what they did. So if I wasn't being there to tell the doctor, this would have been like something that gone out of context, where the doctor is frustrated and the patient is frustrated at the same time. And there's a lot of time that this happens. And that is the I have to like stop and say, okay, I know why it's not going the way you're expecting it, because this is what it is happening right now.